Hi all, my name is Krista Maples and I'm your account manager here at the Boon Group. I help facilitate the group health insurance benefits for HotelPro. Today we are going to go over your benefit options. Those will include the SmartMac, Trans Choice, and 2020 Choice. First and foremost, I would like to identify the three plan options available to HotelPro employees. First is the SmartMac option. Second is the SmartMac with Trans Choice option. Third is the 2020 Choice option. The following slides will break down what each plan option entails. Prior to going over the benefit options, I would like to go over a glossary. This will withhold terms that will be referenced within this PowerPoint. Copay, a payment made by the insured in addition to that made by an insurer. Deductible, the amount you pay for covered healthcare services before your insurance plan starts to pay. For example, with a $2,000 deductible, you pay the first $2,000 worth of covered services yourself. After you pay your deductible, you usually pay only a copayment or coinsurance for covered services. Coinsurance, the percentage of costs of a covered healthcare service that you pay, 20% for example, after you've paid your deductible. Let's say your health insurance plan's allowed amount for an office visit is $100 and your coinsurance is 20%. If you've paid your deductible, you pay 20% of the $100 owed, or $20. Inpatient, being admitted into the hospital or staying 24 hours or longer. Outpatient, a patient who receives care at a medical facility but who is not admitted to the facility overnight or for 24 hours or less. SmartMac. The SmartMac plan covers all services deemed preventative by the U.S. Preventative Services Task Force at no cost to the employee. Key benefits for the SmartMac plans are listed to the right. Plan coinsurance, 100%. Individual deductible, 0. Individual coinsurance limit, 0. Lifetime maximum, unlimited. Maximum unlimited ACA required preventative care or screening, 100%. First Health Network included. Unlimited daily benefit means there is no maximum every day an employee has to go towards services considered preventative services. SmartMac plans generally cover preventative and wellness related tests and treatments. In the event that you get a diagnosis during the preventative or wellness related test, then that diagnosis and any tests associated with it will not be covered by the SmartMac. This is solely a preventative plan. SmartMac with Trans Choice Plan. The Trans Choice Plan is an optional involuntary plan. SmartMac plan must be purchased for eligibility for the Trans Choice Plan. Additional services covered by the Trans Choice Plan will pay at their fixed benefit amount. Key benefits for the Trans Choice Plan are listed to the right. Office visit, $70 per visit benefit, maximum of 7 days per calendar year. For example, if you go to the doctor and your visit that day is only $30, you will receive a check for $40 in the mail due to the fact that you did not reach your $70 per visit benefit. Outpatient diagnostic lab, $10 per visit benefit, maximum of 2 days per calendar year. Daily in hospital, $300 per day benefit, maximum of 31 days per confinement. Hospital confinement benefit, $250 daily benefit, maximum of 1 day per calendar year. Prescription drug benefit, $10 for generic copay, $20 for brand copay, maximum of 3 prescriptions in a calendar year. Simple steps for using SmartMech with Trans Choice Plan. Doctor's visits. Step 1, choose your doctor. If you need assistance locating a doctor, visit www.firsthealthlbp.com to search for an in-network provider. Step 2, schedule your appointment. Provide your ID card information on the phone or at the provider's office. In the event that they have trouble verifying your benefits, please give them the number on the back of your insurance card. Step 3, go to your appointment. Emergency room visits. Step 1, go to the nearest emergency room. Step 2, provide your ID card. Step 3, the applicable plan will pay its portion of the plan responsibility. Step 4, you will receive an explanation of benefits in the mail and a bill from the provider. Both should indicate the same patient responsibility due to the provider. If you didn't pay any patient responsibility at the time of the service, you will owe that amount. Questions? Visit www.firsthealthlbp.com for assistance with doctor verification, or you can call the customer service line at 866-868-4139. (2020) Choice Plan. This is a buy-up alternative plan to the SmartMech Trans Choice combo or SmartMech alone. You cannot have the SmartMech and Trans Choice and the 2020 Choice at the same time. It is one or the other. The key benefits for the 2020 Choice plan are listed to the right. Plan coinsurance, 70%. Individual and family deductible, $6,000 and $12,000. Individual and family coinsurance limit, $6,350 or $12,700. Doctor's office or specialist visits, $20 for general office visit, $50 for a specialist visit. Prescription drug benefit, generic prescription copay, 0. Preferred brand copay, 40. Non-preferred brand copay, 60. Specialty drugs are excluded. (2020) Choice Hospital Benefits. These are the benefits continued from the previous slide breaking down the hospital benefits for the 2020 Choice Plan. Inpatient hospital benefit, 70% coinsurance after deductible and $250 copay per stay. Emergency room benefit, 70% coinsurance after $200 copay per occurrence. Outpatient surgical copay, 70% coinsurance after deductible and $250 copay per surgery. COBRA. If you are terminated or choose to leave your job, you will have the option to enroll in COBRA. COBRA enables temporary health insurance for people who have lost their jobs. Please note, terminating benefits without having been terminated or choosing to leave the company can only be done when a qualifying life event occurs. Please see next slide for qualifying life event examples. You will receive a CEN or a COBRA election notice from Boon via mail. You will have 45 days to respond if you want to enroll in COBRA. Qualifying life event examples. Please see the below chart for a breakdown of QLE examples. There are different columns, including qualifying life event column, the time frame column, which represents the time frame in which you need to report this QLE, the coverage start date, meaning when your coverage will start following the QLE, the required documentation that is needed to be supporting evidence for this QLE, and the action necessary to enroll after the QLE has occurred. Boon Member Services. If you have any questions related to your plan, plan network, or plan offerings, please call the Boon Member Services line at 866-337-8417. This number should also be located on the back of your identification card for your insurance. In the event that a provider has an issue verifying your benefits, please have them call this number as well.